I'm just going to talk over, upper cross postural distortion. We see it all the time. It's epidemic, really. Everybody just about has got some sort of dysfunction. Yeah, Jeff, the pecs are all involved, and the forward head posture and the rounded shoulders. So here's a classic case where you have weakness in the middle lower traps, and just really, whether you want to call it hypertonic upper traps, whether you want to call them overactive. But the bottom line is that forward head posture is just really creating a lot of tension in the suboccipital area. We know those muscles get shortened. We know the upper traps get shortened, and we know the levator scap gets shortened. So we start them off with some CET, and I like to get a good thermal effect. So I'll get them at that 40, but with I'm noticing the back four now, 50, 60%, even sometimes could be normal. But we just, want to get a little warmth in there. Like Cam was saying, let's loosen up those tissues. The soft, it'll be a little more superficial. And just like Cam was saying, I can do my RET at the same time if I wanted, but usually, I just kind of, for the sake of the academy, I'm going to do my CET first, warm up the tissues. Then I grab the RET and I'll do a little RET at the same time, just for time. But I don't generally start out with the RET going, because then I will go into the high EMS. So now you can, we'll see I'll transition out of using some of the CET alone to CET and RET at the same time. There are my settings for that. So now I already ramped it up. So we started off on soft, and I went to deep, right? So it's getting a little bit deeper now. Then I turned on the RET, 40%. This is medium because I really want to, soften those tissues. And then I turned on the high EMS. So there's not an extra video in there, but that would be what we do, because I want to start using the high EMS to start to not only look for those trigger points. And Grant, I looked up some stuff you had brought up last week that the trigger points are hypersensitive. They do have a higher action potential. So the high EMS may be finding those trigger points. So again, that's the same setting. But what'll happen is I'll start to then use the high, we found a hot spot. There you go. Because people will notice it. All right. So we're going to get that contraction. Now we're going to just use the high EMS and the RET as she's doing her scapular retraction and depression to help accentuate that. And Jeff, I understand what you're saying about the pec minor, but I almost find Brugger's is, for me, the most important thing about Brugger's is shutting down the upper traps. It's when they properly engage those mid and lower traps, you get that, I don't know, I'm going to call it reciprocal inhibition, which that I think is the key with our upper cross people, is getting these guys to calm down. And I use strengthening, activating, whatever term you want to use, the mid and lower traps to get people to shut down the upper. Then you can get the sagittal plane alignment. Then you can get the shoulder girdle in position. So I don't know, that's kind of where my head's at right now. Not that it's better, it's just because when you said that, that's what jumped out in my brain. So I got her doing her sagittal plane alignment while I'm doing the TechR, while I have the EMS on those some active motor points. If not, just helping her create that scapular retraction and depression so we get the shutting down of the upper traps. So, I mean, that's really a 5-minute video. Will be up on my YouTube page. But if people want to see the details, but those are kind of the highlights.